Hey, what's up everybody? I'm Dr. Sports Medicine Specialist, and I provide education, information, and commentary on sports and exercise injuries and injury treatments and injury prevention for athletes and active people, probably like you, so that you can stay healthy and perform your best. All right, I am trying these Ask Dr. Geier live videos out. This is the first one of these that I have actually done. I've done some other live videos where I basically just talk and that kind of thing, but it'd be the first time that I'm answering questions. So this will be a little bit of kind of figuring this out as I go. I have some questions that people have submitted or put in the comments below the videos recently. I do an Ask Dr. Geier video every Tuesday. It's on my website. I think I post it on YouTube on the Friday before. And I've been doing that now for, 3-4 years. And I get tons of comments. One of the things I would say that applies to those videos and those recorded videos and the comments that you leave applies here as well. And I make this point a lot. I'm not your doctor. I'd love to be, and you're welcome to fly to Charleston, South Carolina, but I haven't seen you. I haven't examined you, looked at x-rays, MRIs, so I can't give you specific medical advice. I've got like booming fast internet, so I'm not 100% sure why we're getting some glitches. But like I said, it's a little bit of a work in progress. But what I was saying is that I can't give you specific medical advice. So just like I can't do it in the recorded videos, I can't do it here as well. I'm going to try to give you information that does help you make a decision. So when you do go see a doctor, you'll understand some of those terms that he uses. I can, give you my perspective on the pros and cons of different options, but I'm not telling you what to do. So definitely talk to your doctor, and hopefully this helps you have a more educated conversation with your doctor. Also, a couple things, like I say, I'm going to try to answer questions that you leave in the comments. The best way to probably do that is to make them short, quite honestly. If you read the questions that I get and I answer them on my podcast, I answer them in the Ask Dr. Geier videos. If you write 500 or 600 words, I can't read all that. People don't want to hear that. It's just not real likely that I'm going to do that or be able to do that. So I say that not as a way to be rude or anything like that. It's just kind of the nature of it, quite honestly. I can't give real long answers to these questions. So like I said, I do have a few things that I want to kind of go over with you. Hang on. Some questions that people have already shared that I will go ahead and answer. Like I said, if you have questions, feel free to leave those for me. And again, I apologize that I am trying to figure this out as I go, so I will get better at it as I go. But let me go through a few of the questions that people have asked me in recent days on my YouTube channel. And if you're not subscribing to my YouTube channel, please do, because you'll get notified when I'm online answering questions like this. All right, first question that I have, Marvin asks, can a bone heal without wearing a cast? It's funny, this is an interesting question because it came up, some variation of this came up in clinic today, quite honestly, and we were talking about, do you need a splint, or can you just basically go, in a walking boot, or basically just go in nothing, normal shoes? And it really gets to this, do you need a cast or not? Do you need surgery or not? Really gets into what the type of fracture is, what bone it is, and does that bone line up the way that it should? So let's just take, for instance, a hand, and it's like a metacarpal, the long bone in the hand. If that lines up really well and doesn't need to be put back in place, and it stays lined up out of a cast, then yeah, absolutely, potentially you could avoid wearing a cast for it. But if you can't hold it in the right place without a cast, then yeah, maybe you do a cast or a molded splint or something like that, or maybe surgery. So it really depends on what the nature of the injury is. There's going to be certain fractures that it's not even going to be a cast, like your femur, your thigh bone, or your tibia, your shin bone, almost always going to need surgery, at least for an adult. to put a rod down the center of the bone or maybe a plate and screws to hold it in the right position. Not even a cast is strong enough to immobilize that body part to get it to heal in the right position. Others, though, you might get away with it. When I was in college, I broke my ankle and broke the small bone on the outside of the ankle, and I did fine in a cast, and it held it in place. And I had to wear that for about 6 weeks. So yes, a bone can heal without a cast. The key, though, long way of getting to that answer, is that it has to be in a certain position. All right, Annette. Hi, doctor. I love your videos. About 3 months ago, I was grocery shopping, and because I suffer with spinal stenosis, my legs always hurt. I can only walk 20 minutes before I'm in excruciating pain. One day I tried to avoid back and heel pain, so I got up, felt something tear my left knee. Ever since that day, my knee's not been the same. It looks really swollen. All right, couple things. One, a little longer, but hopefully it gets the gist across. One of the things that I think is important, I get questions like this all the time about, I've got X, Y, and Z symptom of whatever body part, and most of the time it's knees, because athletes and active people, that's probably the most common body part injury that needs surgery. But I get the question of, is this a sign that it's something that might need surgery? Is this a sign of something that might be something I should see a doctor for? And I've got an entire post on my website called Signs Your Knee Injury is Serious, and there were 7 that I listed there. And it was things like your knee buckles or gives way, it locks and gets stuck in a certain position, things like that. One of them is swelling. Now, swelling, just a little bit of swelling, that may or may not be a big deal, okay? But if it's really swollen, like swollen up like a basketball, that's probably a bigger problem. There aren't many normal reasons for your knee to do that. Even medical issues like gout or something aren't going to cause that kind of swelling. So if you suffer some traumatic event, you land awkwardly, twist your knee, something like that, probably if your knee is that swollen after you do that, it's probably worth getting checked out. Now, that's tricky because, do you go to an emergency room right away? Do you go to, something where, I don't know, go to, urgent care? Do you go wait a couple days and go to the doctor? There's not a right answer to that. It really depends on how much pain and things like that. But it's worth getting checked out. There aren't many normal reasons. And so when you have a big swollen knee, you're thinking like ACL tear, ligament tear, something, meniscus tear, maybe fracture or something like that. Probably worth getting checked out. All right, one of the challenges I've noticed is the questions come while I'm talking, and then I sort of see them, I sort of don't see them, and so I miss them. So a joint dislocation, it's been corrected. I don't know, I assume he's talking about a shoulder dislocation. Yeah, I think absolutely. If a shoulder pops back into place, it lines up well now. You get all your strength back with, from the initial injury, you get all your motion back. I think, yeah, it's reasonable. It sometimes takes a little bit of time, 2, 3, 4 weeks, but generally people do get back to play. People get back to play American football after these in the season. Now, that gets to a whole other discussion about will you need surgery at some point in the future. But yeah, most people can go back to the gym after surgery. I saw a question about PRP and stem cells. Let me see if I can get that. Will stem cells taken from my hip and injected with PRP into the knee regrow cartilage? All right, so that's a really interesting debate. The studies are sort of inconclusive. They've seemed to show good success rates, PRP and stem cells, with alleviating pain related to early arthritis, essentially cartilage damage. The evidence that they're actually causing the cartilage to rebuild has not been as great. Now, I think they're going to continue to work on it, and I think they're eventually going to figure it out. I don't know that it can guarantee that it's going to rebuild cartilage. When I offer it to patients, I say, hey, this is a reasonable thing to try for a lot of people, and it can help with pain, but I usually don't promise that it's going to help regrow cartilage. There may be some studies, because there's billions of dollars going into stem cell and PRP research, and there may be some studies that are showing early success at rebuilding cartilage, but I don't know how successful that is. And it's hard to know for sure because we don't go in and scope the knee or scope the hip or scope the shoulder, just to see cartilage regrowth, things like that. All right, Zach asks, I had an MRI. It said I have a slap tear. Is that a minor tear? Can I still throw with a minor tear? All right, a superior labral tear is along the socket of the shoulder. There's a tear of the labrum, the cartilage bumper at the top of the socket. And here's one of the things. Those slap tears or superior labral tears don't always heal on their own. In fact, they very reliably don't heal. But that doesn't necessarily mean you have to have surgery. There's studies that show really good success rates at non-surgical treatment for labral tears, at least at your pain going away. And a lot of times that's physical therapy. So it can be the right thing to do for people with symptoms related to that for sure, but I don't think that there's anything that you have to rush right out and do surgery for a superior labral tear. You can try to go back to exercise. Try to go back to sports, doing therapy and things like that, and see how your shoulder responds. If nothing's working and you just can't do it because of pain deep in your shoulder, then maybe it's a reasonable thing. All right, as I pull up some of these other questions, remember, if you're watching this recorded, I apologize because you're not going to get your questions answered. Remember to watch live, and the way you can know I'm online is to subscribe to my YouTube channel. So click the subscribe button in the upper right corner of the page. I will say as well, if you want advanced notification on chat pull up, if you want advanced notification of this video, there's a link to, I think it's called Dr. David Geier Sports and Exercise Injuries List. And I let those people on my list know, in fact, I let them know on Monday that I was going to be doing this. So you'll have advance notice of when I'm going to be online so that I can answer questions from you. If you have questions, please leave them. I've actually got a bonus if you're watching this live. So I'll mention that maybe after the next question. So definitely leave them in the chat. I would love to try to help you out any way I can. Randall asks, I climb power poles for a living and I tore my ACL. Do you think surgery is the way to go? I've not tried to climb a wood pole. I lock my leg out to keep me from falling on the pole. All right, I literally just did a radio interview a few minutes ago where we talked about this very idea. Would you treat an athlete different than you would treat somebody else? And the reason athletes typically need an ACL surgery is that their knee buckles. Where's my knee model here? Your knee buckles when you go to land from a jump or when you go to change directions. And if your knee's giving out like that, you can do more harm to it. You can damage the meniscus or tear the articular cartilage, things that lead to arthritis down the road. Plus, you just can't play with an unstable knee. It just doesn't work. So we almost always talk about surgery for an athlete. But I would extend that a little bit further. And again, not just pro athlete, but recreation level, high school level, youth level even. But I would tell you, active people, be it exercise or they're active for their jobs, a lot of times need surgery as well for the same reason. Just like he's talking about here, their knees giving out when they're doing their, his basic duties. I think it's reasonable to go through a surgery. No question. Long rehab. I get that. Long rehab. But it's at least something worth thinking about to restore stability of the knee, let you get back to what you want to do safely. Now, there are some people that do okay without surgery for an ACL tear. You work at a desk job, all the exercise you do is like running straight ahead, things like that. You may do fine, but if you do anything that's really physical, especially that involves landing or running, changing directions, planting your foot to the other way, it's really hard to do anything like that with a torn ACL. So, my perspective on that. All right. Ashley asks, hi doctor, yesterday I was running and I rolled my ankle. I immediately started limping and crying. I'm still limping and the pain's getting worse whenever I step and jump. There's a sharp tingling pain in my foot. Should I get it checked out? There is an article on my website, and I think it's a video on my website, on my YouTube channel as well, something to the effect of signs your foot and ankle injury is serious. And one of the things I talk about is difficulty bearing weight or inability to bear weight. So if you go to basically step down and it's just excruciating pain, especially if you give it the night, you ice it, you elevate it, and then even the next day it's hard to bear weight, I think it's reasonable to get it checked out. When I was in college, I broke my ankle and I thought I had just sprained it. I stepped awkwardly while running, half my foot on the pavement, half on the little drainage ditch, rolled it. I thought I sprained it and I couldn't put any weight on it at all. I mean, I had to hobble all the way across campus back to my fraternity house and it was just brutal. And so I knew right away, like, this can't be just an ankle sprain. I've sprained my ankle before. I know what that is. So I went to Student Health, found out, or actually they sent me to one of these doc-in-the-box places to get x-rays, go back to Student Health to find out the reading, which was, yes, I had a fracture, go to an ER to get a cast, and then that's how I was treated. So yes, it's worth getting checked out, especially if over 12, 24 hours, you really can't put any weight on it. It's not getting better. Now, if it's like there's a deformity, if it's swollen up like a basketball, there's some things that might also, make you more inclined to get it fixed. So while I pull up some more of your comments, your questions, and again, leave your questions in the comments below this video. Remember, I can't give you specific medical advice, but I can certainly give you information and education that helps you make a decision that's best for you. If you're watching this recorded, I apologize because these are questions that you're submitting. So subscribe to my YouTube channel and you will get notification when I'm online live. For the people that are listening and watching this, I do have a little bonus for you, and really anybody that watches this within the next 12 hours only. So this is why it only helps the people watching. All of my Ask Dr. Geier programs. I've got these programs on any body part you can possibly injure, sports and exercise type injuries, shoulder, elbow, and forearm, all sorts of different knee injury programs, foot and ankle fractures, stress fractures, hip, low back, all this kind of stuff. I've got these programs with hundreds of questions that I answer in video form, in audio form. They're really, really helpful. And there's any question that you possibly could have about your injury and tons you've never thought of are in these programs. Normally those are $49, but for the next 9 hours, next 12 hours, I guess I'll say, they are going to be only $19. So tomorrow morning sometime, they'll go back to their normal $49. The informational page for each one will say $49, but if you click on the order button, the order page where you put in your payment information says $19. Definitely check those out. They're my most popular program that I have. And people tell me really good things about them. Whatever your injury is, I think it can help. So definitely check that out. All right. Somebody asks, and I may have missed more of the beginning of this story, but what about ankle cracking? Typically, this is kind of an interesting discussion generally about bone and joints especially cracking. I get that question with knees all the time. My knee pops, my knee grinds, my knee cracks, and it's a sign of something bad. We'll talk about the ankle in a second, but the thing about the knee is that the vast majority of the time, that's not a big deal. And as orthopedic surgeons, we don't get worked up about it. If you go find a girls' high school soccer team and feel their knees and have them put their knee through a range of motion, at least a third of them are going to have this popping, grinding sensation under their kneecaps. And yet they don't have any structural damage. It's how their kneecap tracks and a number of different factors. So we don't get too worked up about popping. Now, if you have ankle issues, again, it's probably not a big deal. Your ankle may be swollen for some reason that's making the bones kind of move and glide over each other abnormally, but we don't get too worked up about popping or cracking. What we get worked up about is if it's really painful when it happens. We try to figure out what the cause of that pain is. All right, just because it's on the screen right now, Tommy, I've had an ACL tear and had surgery. Darn it, it left the screen. Here we go. I had an ACL tear, had surgery for it last August. From then on, I've done a lot of rehab. Now I'm sprinting. I'm too far away from making, or am I too far away from making full recovery? So here's the thing about ACL surgery. It's the media really kind of gets this wrong when we talk about pro athletes. They're like, all right, I'm a big Liverpool fan. You can see my Liverpool scarf there, and I got one over there. Big Liverpool fan. Alex Oxlade-Chamberlain tore his ACL against Roma in the Champions League sometime in April. And there's all this. In fact, I just read an article a few minutes ago that they hope he's ready by November because it's a set amount of time out from his ACL surgery. It doesn't work that way. We used to do that like 20 years ago, but the amount of time after an ACL surgery is not how you decide when it's okay to go back to sports. It's much more based on when you get your motion back, when you get your strength back. and then you start jogging, and then when you can land and do sport-specific drills. So in soccer, you've got to be able to land from a jump. You've got to be able to run and plant your foot and change directions and balance on one leg. And there's all these different criteria that say, all right, then you're ready to play. And that's why I think physical therapy is so, so important to help you get to full recovery. Because I think you just giving it time is not going to get you there. Getting that balance back, getting that joint position sense, what we call proprioception back, being able to do those sport-specific drills is really, really hard without physical therapy. And not just for 2 or 3 months, but a lot of times, with the athletes I take care of, they're in physical therapy for about 6 months. And it can be about 9 to 12 months before your knee really feels normal, feels like the other side. So that's one of the tricks with ACL surgery, is that it takes a lot of time. All right, let's see. Riley, if a slap tear gets treated with physical therapy by strengthening shoulder muscles, when physical therapy is over, would you lose the strength again? It keeps going away on me. And bringing back pain. Basically, is it going to need surgery eventually in life? No, it's a really good question. No, typically you're not going to lose that strength, even though you might have to do some of those stabilization exercises every so often, like 2-3 times a week. The real question, and part of the reason people think that slap tears do well, a lot of people with slap tears do well without surgery, is that there's a huge false positive rate with MRIs for slap tears, meaning that you may have an MRI that shows a slap tear, and you may actually have a slap tear in your shoulder and not even know it, but that's not the source of your pain. And so I think a lot of the times the people that get better, what the slap tear just is an incidental finding, that's not necessarily the source of your pain. But yeah, I'm a big fan of trying physical therapy, and if that works, then maybe work back into the exercise, the sports, the work you do, see how it goes over the coming, weeks, months. If it, keep doing the maintenance exercises and then figure out how it goes after that. Remember, guys, I told you I can't give specific medical advice. I can give information and education. Please do not assume I am telling you what to do, because unless you're here in Charleston, South Carolina and seeing me in my clinic, I haven't seen you, examined you, so please just keep that in mind. General information only. Osama, I'm an orthopedic surgery resident. Very cool, in Iraq. I remember how hard residency is, so I feel for you, big man. And he says, I had a Fouche injury, which is fall on an outstretched hand, basically a distal radius fracture. I had a DC instability. Interesting. Does this affect my career, and should you have surgery? All right, Osama, I will say on the front end, I am not a hand and wrist surgeon, so I am probably not the best person to give you advice on that, but I would see a hand or wrist surgeon and find out, because as somebody that does surgeries, like you're going to be doing surgeries, I think I would want to know if this is going to limit me. Is it going to cause arthritis? Am I going to get stiffness of the wrist? Is it something that's going to make it hard for me to do what I want to do? So I think that it's absolutely worth finding out. All right, Jay, I have mild joint effusion from an injury of the meniscus. Still not solved, still have swelling July of last year. There may be more to that. Again, remember, please try to keep them short. Swelling after meniscus surgery is kind of rare, quite honestly. Maybe for 2 weeks, maybe for 4 or 6 weeks if it's a trimming out surgery. If it's a repair where we actually put stitches in the meniscus and sew it back together, that can swell a little bit longer. But no, typically you don't get too much swelling after about 6 weeks. So as you get back into running and things, sometimes it might swell, but close to a year out, I can't come up with any reasons related to the meniscus surgery, assuming it's all gone well, that are necessarily that I can't give you a good answer for why somebody would have that. All right, I don't know if it's Dylan or Dial On. I apologize if I'm getting that wrong. Hi, Doc. I have serious recurrent shoulder dislocations from about, I assume that's age 14, or I don't know, 2012. I'm getting an apartment this June I'm getting an appointment, for surgery in June. I play badminton. I want to ask if it's possible for me to play again. Okay. I love shoulder instability surgery. It's probably my favorite surgery that I do. I think surgery, if you're having multiple dislocations, it's the way to go. If it's been popped out and somebody's had to pop it back in and it's gone on 2-3 times, the chance that non-surgical treatment's going to work is really low. Can you get back to sports? Absolutely. There's about a 10% recurrence rate with these injuries, even after surgery. But the goal is absolutely to get back to what you want to do. It's a long process, usually about 4 weeks in a sling or shoulder immobilizer, then a lot of work to get motion and strength back, a lot of work to get overhead ability back. So it can take 4 to 6 months, but yeah, usually people get back to sports after that surgery. All right. Can I play football with a torn meniscus? Something else that I just talked about today in clinic, not football, but something, can you do something, sports work, that kind of thing with a torn meniscus? And get your questions in now if you're watching live, because I'm probably going to answer 2 or 3 more and then we're going to call it a night. Yes, I think it's reasonable to try. The thing about a meniscus tear, just so you know, is that's the C-shaped cartilage. Let's see if I can show you that on this model, right down here, C-shape, and there's one on each side. And that typically does not heal on its own. Maybe in really young kids it does, but in adults that just doesn't happen. You could try to play through it. Most of the time with twisting motions, with deep knee bending and squatting motions, and even the impact from running, people just can't take the pain. But if you do it and you're like, that doesn't hurt so bad, certainly try it. I don't know if he's asking about football like in what Americans call soccer, or we're talking about American football. I would think soccer, European football, or football the rest of the world would be really difficult with a meniscus tear. But I don't know that that somebody's doing harm trying it. You just get out there and see how it goes. And if you just can't do it, then you bite the bullet and have surgery. All right, few more here. Let's see. And you're welcome. And again, I don't know if that's Dylon or Dylan. I apologize, but you're very, very welcome. I just love this name. There were some earlier ones I was going to answer, but I just saw this answering his question. So I'm going to go with Fun with Grandma just because I think that's a hilarious name. Congrats to you on the funny YouTube channel name. I'm sorry I don't know what happened about Fun with Grandma. I need advice on the best. This thing keeps... Best therapy for my knee. I can't lift my leg from the knee down. I had surgery. It's gonna be hard for me for 2 reasons to kind of give you advice on how to rehab. One, every knee surgery is going to be different as far as what you're allowed to do. Like I did a meniscus surgery today and 2 ACL surgeries, and the ACLs, what they're allowed to do is very different than what the meniscus surgery is. So this is one that's better addressed to your doctor in terms of how much weight you're allowed to do, how much you're allowed to bend it, what strengthening exercises you're allowed to do. I'm a huge fan of physical therapy. I think that's the best way to get strength back after a surgery. Rather than trying to do it on your own and go into the gym, working with a physical therapist, critically important because they can do it in a way that's really, really safe. The other challenge is I'm not a physical therapist. Somebody else earlier asked about giving specific exercises to do. That's not what I do. And orthopedic surgeons, we just don't do that. I mean, I know some exercises from personal injuries I've had, and obviously I've lifted weights forever. I know that. But I can't go through, I can't examine somebody's knee or you tell me what your injury is and me know, do you need VMO strengthening or hip flexor strengthening or any of that? Go see a physical therapist. That's kind of the best way to kind of overcome some of these problems. All right, any more questions? Remember, if you are watching this recorded and you are not watching live, Osama, I love that. By the way, I love your show and always listen to your podcast on my way to work. That means more to me than you know because I've been debating about how much longer to do that podcast. So I'm thrilled that that's helpful. If you are watching this recorded and you missed it live and you missed your chance to get these questions answered, subscribe to my YouTube channel and you will get notified when I'm online. I'm going to try to do these about every month or so, 30 minutes, 45 minutes, depending on how much time I have. If you want advance notice of when I'm going to be online, in the description below this video, there's a link to my email list, Dr. David Geier Sports and Exercise injuries email list, and I give you 2 days to a week's notice of when I'm going to be doing these. So also for the people that are watching this for the next 12 hours, and I haven't put the link in the description yet. I'll do it here in just a second as soon as we're off the air or off live, but you can have any of my Ask Dr. Geier programs, audio questions, video questions, hundreds on every topic. ACL injuries, meniscus tears, shoulder dislocations, all that. Those programs are normally $49. You can get them in the next 12 hours for only $19. But by early tomorrow morning, that will go back to $49. So you really click on that tonight. Stick around on my video. Click on the link in the description, and I will get those to you. All right, last question. And it's you're just lucky because it's the one right there. Can medicine like joint care help me from recovery of a joint dislocation? I don't know what joint care is. I would assume it's some sort of glucosamine chondroitin thing, but I wouldn't think that there's, or maybe it's an anti-inflammatory or cream, who knows, any kind of medicine that's going to make a huge difference on that type of thing. I think more than that, ice and stuff to get the swelling down, starting to work with a physical therapist to get motion better, and then plus or minus surgery depending on what the problem is. That would be the way to go. All right, I'm going to stop there. I am extremely appreciative for you watching this first effort at Ask Dr. Geier Live. Like I said, I'll try to do these every month. I've got some more videos and live videos, fun type sports medicine stuff coming in the coming weeks. So definitely subscribe to my YouTube channel. Subscribe to my email list. You'll get advance notice and all sorts of other cool stuff. And remember, the Ask Dr. Geier programs, audio and video questions, all the questions you have, plus tons you haven't even thought to ask. I'll put the link below that. Just look for that here in just a second. Thank you guys so much for watching.